Here, everybody, I couldn't be with you today because I have COVID. So I have recorded this introduction to how you should do a pathology explanation OSCE. Often sharing information with a patient occurs naturally during a consultation. However, there are OSCE stations where providing clinical information is the focus of the OSCE. And in these situations, the key to success is having a structure. So the first thing you want to do is to open the consultation as normal. You clean your hands, you introduce yourself, you check you've got the correct patient, and then you do a very small amount of whakawhanaungatonga because you don't actually have much time. Then step 2 is you check the patient's agenda. What were you expecting from today's consultation? And hopefully they will say something like, I've come to have my pathology results explained. Then the next thing you do is you check the patient's prior knowledge because you want to explain at the right level. So you check your patient's understanding, and then you structure and adapt your explanation and your questions to the person, depending on what they already know. And the key phrase is, tell me what you understand about your condition. Okay, so when you're doing the actual explanation, which is the most points in the explanation OSCE, there is a structure that you can use, and this needs to be adapted as needed. So you don't need to go strictly to it, particularly the normal anatomy and function, if that's just common knowledge. So normally you would say what the normal anatomy and function is, then you'd say what the disease is, then you would say its cause or its pathogenesis, you would say its problems and complications, and then you would go on to the management. They don't need to know anything about what it looks like down the microscope, so don't talk about the histology at all. Now, when we explain things to people, it's really important that we break it down into sizable chunks and check they've understood that chunk before we give them even more information. It's been shown that people remember things really poorly from encounters with doctors, and the only way to improve it is actually check that they have understood. We do this by a method that's called teach back or ask, tell, reflect. So you ask what they understand, you tell them about it, and then what you do is you ask them to explain it back to you. Okay, so it's on you to be the one that makes sure they've understood. So don't say things like, I want to check that you've understood. That is not right. It puts the emphasis on them. What you want to do is make sure the emphasis is on the explainer. I want to check that I've explained this well. Can you tell me what you now understand? Okay. Would you be able to repeat back the key points of what I've said so far to make sure I've not missed anything? It's all about you being the good explainer rather than them being the understander. So checking is the key. It's your responsibility to explain it properly. And here on this page are a few phrases that will help show you what a typical thing might be during an explanation, and you can use them in various settings. I wanted to make sure I was clear about the pros and cons of. Could you tell me what you now understand so I can see that I've explained them properly? And then step 6 is encourage the patient to ask questions. What are the patient's concerns regarding their symptoms and diagnosis? How do they feel about the information that you have given them? And then we need to have a nice package summary and and the patient should go away with a little package knowing exactly what's going to happen next going forward. Okay, so that's an awful lot to do in 7 minutes for the surgical OSCE station. So you need to practice. You need to practice so it just kind of comes out. And I think that before you go into your OSCE, you should have done at least 5 practices with another person being marked. Finally, to close the consultation, you thank the patient for their time. Oh, and it's also okay to offer the patient supporting written materials or website links so they can learn more about the topic. So what is in the curriculum that you might need to explain? Well, we can find it here. Each of your tutes has got core conditions, and those core conditions, which are shown here, we can ask you to explain any of those. What does the marking scheme look like? Okay, so in a minute, we're going to give you three cases to work through in groups, and each of those will have a marking scheme. They're all similar to this. So the first is that the student identifies deficiencies in the patient's knowledge. We presume that you're all going to do okay about introducing yourselves and Vokafenona. That's kind of given. That we have information given. Yep, in a nice logical thing here, okay? So it talks about normal anatomy, the cause, the natural history, complications that the patient might want to know about. That means they should be seen immediately, management, and then you get marks for doing it in a logical sequence. You get marks for checking that they've understood. You get marks for checking their ideas, feelings, and beliefs, and whether or not they have any questions. And then you get a mark for kind of having a plan at the end about how to proceed. So as I said, a top tip for passing is to, in fact, practice all the time. My cat, you might have heard meowing in the background here. It's currently sitting just behind me, but here she is. Her name's Stormy. And you can practice doing explanations to anybody, including your cat. And you can check that it is okay by referring back to the pathology notes. So I tested positive for COVID this morning. And I was, if I was explaining COVID, I would say something like, COVID is a virus that infects your lungs. So your lungs are needed for normal air exchange, so you can get oxygen into your blood. You can get infected by COVID by breathing in particles that have the virus in them, and it can affect your throat, giving you a sore throat and a runny nose, but can also move deeply into your chest. And when it's in your chest, you might notice that you cough more. If, however, you have any changes where you have difficulty breathing, or you'll notice yourself changing color, if you have a severe headache or a very high fever, you should definitely contact your GP. Most people will have a mild course. You should manage it by having fluids and by taking ibuprofen. I just want to check that I've explained that okay. Could you let me know what you now understand about COVID? Okay, so that was an example of me explaining to me about having COVID. And that's the kind of explanation that we're looking for. What I'm going to do now is I am going to show you where on the Moodle Drive we have stashed our cases for you to practice. Here, if you go to the Moodle page, you can scroll down. This is where you'll find the MCQ exams that you'll be able to do soon. If you keep going, you will find the surgical module pathology. And if you click on it, It will open up. All right, this here is the PowerPoint of what I have just explained. And here are 3 practice cases for you. So if, for example, we'll open up case 1, you will see that in it, there are instructions for a patient, an examiner, and the student. So what I'd like you to do now is get in groups of 3, open up case 1, you're going to have to download it, and then what I want you to do is to practice in your groups with a patient, a student, and an examiner. What's really useful is that these cases are all of colonic polyps, but they're slightly different. So if you practice one after the other, then you will be able to see what's similar and different about each of the scenarios. If you're doing medicine, then what you can do is just go to medicine. And similarly, we have 3 practice scenarios that are on diabetes here. Okay, so if you have any questions, please email me. I am checking my emails, even though I'm mostly just resting at home at the moment. Good luck.